Hi, it's Dr. Ron Miller here with cashbasedphysiotherapy.org, and we are going over step 6 of my cash-based physiotherapy checklist to open up a cash-based physiotherapy practice. So step 6 is going to be documentation. Now, in a previous lecture we've already gone over, you have to know your State Practice Act. It will tell you what your minimal documentation standards are and what you have to do. So should you use electronic documentation or paper? Now, right now, if you're opening up a cash-based clinic, I recommend going paper. Don't get the increased overhead of electronic documentation. Start out with paper and make sure that you meet your minimal documentation guidelines. And that goes from evals, progress notes, discharge statements, consent to treat, notice of privacy practices, etc., and all your other forms and stuff like that. And most of all of my paperwork you have access to with Business 101, so you don't have to recreate the wheel or anything. If you sign up for my system, you get all of my documentation on paper. So you don't have to, but if you are going to create your own stuff, I recommend consulting with a healthcare lawyer to make sure that you meet, your consent to treat is legit, your notice of privacy practices is good, your PHI stuff, because your documentation will have the medical history forms and stuff like that. So to make sure that you do it right, I would recommend consulting with a healthcare lawyer. But if you don't want to spend the money for that, you do get all of my documentation formats in Business 101. But in the big picture right now, I would recommend staying with just paper documentation. It's not worth the expense of having these higher quality electronic documentation records for them. Plus, you don't really need that because you're not limited by any insurance, or you don't have to submit to any insurance. I do have a form that is a master reimbursement form for my patients. Again, it's all on paper. Now, if you end up using like Google Drive or any kind of Google stuff, for your documentation, that's another option to do. You can actually pay Google, and I think it's like $5.99 a month for each user, and they will encrypt your email, and you'll be able to document on forms and store it in the cloud, and it is encrypted and HIPAA compliant. So that's another thing that you could do. If you don't want to do straight paper, you could do electronic documentation, not with like billing stuff, but document electronically on your computer and store it in the cloud in a HIPAA compliant setting through Google. And there are some other documentation systems specific for physiotherapy. I haven't gone into them because the cost is too high. So remember, if you follow me at all, you know that my goal is to keep my overhead low, especially when starting out. But I would recommend just starting out with paper documentation, and then as you grow your business, you can look into other opportunities of looking into electronic documentation, make sure it's cost effective and it fits your needs. And again, if you have any questions or concerns about documentation, what forms to use, what works and what doesn't, please put a comment in the comment box below. Send me an email. I'm here to help. But this is this step about documentation forms and what I recommend to use when you start out a cash-based clinic. Thank you for your time.